Hello, good afternoon, good morning, good evening for all that are joining this webinar. Welcome to the Mind the Gap webinar using diet, cost, and affordability metrics to inform food security and nutrition-sensitive social protection. While we wait people to come, I'm just sending a few kind of reminders. The session will be recorded so that it will be available later on as well. And also, please put your questions in the Q&A box as throughout the duration of the webinar, so that we can then address the questions later during the Q&A session. Let's wait a little bit. Let's give a few minutes until people come on board. So that before we start, but welcome to all. As people are joining, let me introduce myself. I'm Giulia Baldi. I'm the head of social protection in the World Food Program, based in Rome in our headquarters. I will moderate today's session. And before I start with presenting a little bit the run of show for today, I would like to give a quick introduction of the topic that we are going through today with our stellar panel, which is really about connecting evidence to inform nutrition-sensitive social protection. Social protection can be used as a powerful mechanism to address the vicious cycle between poverty, malnutrition, and food insecurity for key vulnerable groups and in different contexts, and tailoring the solutions to the context. And to do that, key evidence is really, really important, and evidence that can inform a solution to address main barriers against this vicious cycle. And one key barrier that has been identified is really that affordability, cost of the diets, of nutritious diets, and affordability of nutritious diet is one of the main barriers that continues to propagate this vicious cycle between poverty, malnutrition, and food insecurity. And today we're going to look at one specific tool, an analytical tool that helped unpack the point and the concept and the issues related to an affordability of nutritious diet in different contexts, and to inform policy and programmatic dialogues with countries, with governments, with different sectors on how to address this unaffordability gap for better addressing and have better impact on both malnutrition, food insecurity, and poverty. And actually, in particular, we're going to look at the use of this tool, the field the nutrient gap analysis, to inform dialogues on solution using social protection as a key platform in relation to other sectors and other programmatic opportunities. So this is so please, like, if we can move to the next slide to just go through the run of show for today. So we are going to start with looking at what is the field and nutrient gap, and a snapshot of what the approach has been through this analysis, and also the relevance of the field and nutrient gap for social protection, how it's been used. And then we are going to move to a country dialogue in the second segment of the webinar, where we look at the perspective from different contexts and from users of this analysis on how it's been used and what has been its relevance, what have been the barriers that have been identified, what have been the solutions that have been used and identified as part of or in consequence of the use of the tool. And then we're going to move to a Q&A session and a quick wrap-up. So now let me pass to just presenting and introducing our stellar panel of today. Next slide, please. So for the first segment, we are going to have two thought leaders in this field, in the field of nutrition-sensitive social protection. We have our own Saskia Depe, Senior Advisor on Analytics and Science for Food and Nutrition from WFP, from the World Food Programme at headquarters, and Professor Stephen Devereux, who is a fellow from Institute of Development Study and a main thought leader on nutrition, not only on nutrition-sensitive social protection, on social protection in general. So really, really honored to have you both here today with us. And then let me introduce you also to the second segment and the speakers for the second segment. So this segment will be moderated by our own Juan Gonzalo Jaramillo Mejia, who is head of social protection in WFP Iraq, and also have been instrumental in actually conceptualizing and working and collaborating with partners actually for the publication Mind the Gap, which is really looking and connecting FNG, the use of FNG to social protection. And then we have our speakers that are going to feature country experiences. We have Dr. Azim Hijaz, the Director General of the Benazir Income Support Program in Pakistan. Then we have experience from Ethiopia with Rebecca Johannes, who is the lead of social protection and country capacity strengthening from WFP Ethiopia, and Carla Mejia, who is our regional nutrition advisor in Latin America and the Caribbean for the World Food Programme. So welcome to all. And now let's move to the first segment. And I give the mic to Saskia to start the presentation, followed by Stephen. Thank you very much. Over to you.
Thank you very much, Julia. And good evening, good afternoon, good morning, everyone. So it's a pleasure to share with you how we have been applying the cost and affordability of healthy, nutritious diets metrics to design food security and nutrition-sensitive social protection. So on the next slide, I first want to underline why investing in nutrition is so important. And that's for human capital. It's for survival. It's for prevention of stunting, which is basically undernutrition that causes underdevelopment. And there's a high development cost for individuals as well as for families, societies, and countries. And it's also very important for schooling, for the potential of children to pick up the learnings in school. They need to be well nourished from very early in life and throughout life and throughout the school age period. So to the right, you can see the extent to which undernutrition, malnutrition affects people. So globally, 22% of children are stunted, which reflects undernutrition early in life, and therefore that they cannot develop and function throughout life to their potential. Also, 1 in 2 children under 5 suffer from at least one micronutrient deficiency, and that impacts health today, and it impacts development. And expressed in economic terms, the per capita GDP penalty from stunting ranges from 10%, from 7% to 10%, and there's even higher numbers for individual countries. So there's a lot of reason to invest in nutrition to prevent these costs. And when you invest in nutrition, $1, you get a return of $16. And that is because of better health, better productivity, and also better cognitive capacity. So the productivity is physical as well as intellectual. The recent World Bank report, the investment framework for nutrition, calculated that an investment of $13 billion is needed annually to scale up nutrition interventions. And you can also see the investment that requires per individual per year. Now, with those investments, you get 2.4 trillion of economic benefits, and you avoid if for inaction, it will cost you 41 trillion. So that gives, again, the perspective of how much return you get if versus not addressing it. And school meals also generate economic returns through improved health, education, as well as productivity. So then the question is how to invest in nutrition. What should you do? So on the next slide, you see that basically diets are at the core. So through diets, people nourish themselves. And for that, you must take a look at the food system, so at the food production, at the food distribution, at the food environment, and then consumer behavior and how that results in diets. And what we do with the cost and affordability metrics is that we really look at the economic access, but also in a way physical access, because only what is in the market can be purchased. So it's about the price, but it's also about what is in the market. So on the next slide, you can see that the cost and affordability metrics, they are increasingly being used. In 2004, Save the Children developed a tool in Excel to do linear programming to, based on food prices, select a combination of foods that could meet the nutritional needs. And that gave us a cost metric that we can compare to what can people spend on food. Then since 2016, we have been using these metrics at the World Food Programme. And in fact, in 2020, the SOFI report, the flagship report from the UN agencies on food security and nutrition, had the theme of the report on cost and affordability of diets. And since then, the healthy diet cost and affordability is part of the annual report as both a food security and a nutrition indicator. And now we're seeing governments starting to take up those metrics for regular monitoring and reporting. And on our side, we have started developing a platform to facilitate access to the ways to calculate those metrics. So what does this mean? On the next slide, you see a conceptual picture. So the curved line presents expenditure on food, and the horizontal lines present the lowest one, the cost of just meeting energy needs, and the higher one, the cost of meeting nutritional needs. And so you can see from here what proportion of the expenditure is below the cost of a nutritious diet. So that's the proportion of people who cannot afford the lowest cost nutritious diet if they were spending their money optimally to obtain a nutritious diet. And you can also see how deep is the affordability gap of people who cannot afford a healthy diet. So globally, 38% of the population cannot afford a healthy diet, but in low-income countries, this proportion is as high as 88%. And then you can also understand that affordability gap, where more people cannot afford it, also gets deeper. And then on the next slide, you see a graph that we produced at the time of COVID, because we wanted to see to what extent COVID impacted affordability of diets. And the green part is the proportion of people that could afford the healthy diet in 63 low middle income countries for which we did this analysis. So already more than half, 39% only could afford a healthy diet, and the other 60% could not. And for example, if you look at the yellow part, that is the proportion of the population that could not even afford 50% of the cost of a healthy diet. So they are very far from being able to meet their health and nutritional needs. So their diet is really lacking in the foods that you need to meet all your nutritional needs. So that's why monitoring of cost and cost of a healthy diet and then is also good, because it can tell you how is this going in the population. The next slide is some numbers from Nigeria. So here you see to the left that just meeting energy needs costed at the time of the work 141 naira per person per day. But below that, the cost of a nutritious diet, meeting all your nutrient needs, or in the middle, the cost of a diet that is adequately diverse as per food-based dietary guidelines, they costed almost the same. And I don't want to go into the differences because they're not so important. And you can see that they are like more than twice the cost of just meeting the energy needs. So that's also the same as you saw with those two bars that I showed you on that conceptual slide. So the cost of meeting your nutrient needs through a diverse diet are much higher than the cost of just meeting energy needs. And many poverty lines, they are based on meeting energy needs from a basic food basket. So they also don't present the cost of meeting the health and nutritional needs. Next slide. So here is an example from Zimbabwe. In gray is the cost of the energy-only diet. And then in blue, the cost of a diet that meets nutritional needs. And you can see that the cost difference can be up to 4 times as high. So this really depends on the food environment. Typically, we find a difference of 2 to 3 times. But if the food environment is more constrained, there's fewer food options, then the cost can be this much different. And then it's not only the cost, but it's also, of course, what people can spend on food that then determines what proportion could not afford a nutritious diet. On the next slide, you see those proportions in Zimbabwe. So you can see that almost everyone can have enough food to meet their energy needs, but that's then very limited number of foods, very basic, that are not providing enough of the essential nutrients, whether we're talking protein, vitamin C, iron, vitamin B12, etc. Yeah, and then on the next slide, you see how the costs are distributed within an imaginary family. So you see here a family of 5 people, and you can see that the adult man needs around 24% of that cost of that nutritious diet to meet his needs. The adolescent girl, she would need 27%, even when she needs less energy compared to the adult man. She has higher needs for specific nutrients such as iron and zinc, and these come from foods that are more costly. So she needs more what we call nutrient-dense foods, and they have a higher cost. So therefore, her cost is higher, and it also means that she is now more vulnerable to malnutrition, because when foods are shared on a quantity proportional distribution, she may not get sufficient amounts of those more nutritious foods. So it's also about sensitizing what is required to meet the needs of the specific individuals. So on the next slide, you see how we use these metrics to then engage on what can different sectors do to make access to nutritious diets more possible. So in the bottom right, that's about increasing the availability and lowering the prices of nutritious foods. And here we're showing 2 interventions that were modeled for Cambodia. But in this quadrant, we typically look at interventions from the agricultural sector. Then the part to the left is about increasing the nutrient content of foods. So this is, for example, where fortification comes in. The fortification of foods for the general population, as well as for specific target groups. You can see complementary foods, for example, processed complementary foods. And then to the top left, That's about household income and food expenditure. So this is, you can see it, where social protection transfers can come in. So we can look at how much can a transfer contribute to lowering the cost of a nutritious diet and to being able to afford it. And to the top right, you see further specific interventions for specific target groups. So based on this, we engage with sectors to discuss what they might be able to contribute. Next slide, please. So zooming into social assistance, what this does to our curve and to our affordability gap. You see the bottom line is the curved line is the food expenditure. So if you give a cash transfer, that food expenditure increases, so you can lower the gap in that way. Then on the next slide, you see what you can do to reduce that cost of a nutritious diet. And that's where you need to work together with different systems. So when you work with the food system, you can work on increasing that productivity and diversity of nutritious foods. I mean, that's largely done by the food system. And that can lead to increased availability and lower prices of nutritious foods. So that brings it better within reach and can lower the cost. Reduction of post-harvest loss works similarly. And also increasing that nutritional value. So through biofortification or post-harvest fortification. And then through the health system, there can be supplementation for specific target groups. So it's about linking social assistance with interventions from the health sector, securing that those get delivered. And of course also promotion of breastfeeding. And through the education system, you can provide nutritious school meals. So you can come at this affordability gap from different sides and involving different sectors. Next slide, please. Yeah, so I'm now going to show you a few slides on how we look at those, the impact of those different interventions on that affordability gap. So what you're seeing here is for Kenya. You see 5 expenditure quintiles. So all of them, the green bars, are lower than the monthly cost, which sits at 12,000 for a nutritious diet. But you can see in gray the gap, and the gap gets smaller when you move along the percentiles. And in blue, you see the impact of a cash transfer for young children. This is a child benefit grant. So the child benefit grant contributes to the affordability gap, but it is a relatively small contribution. So there is a need to add further interventions to reduce that cost and improve the access. Next slide is for Zambia. So there you can see, again, different rural households, urban households for the bottom 10% in this case, the food expenditure in yellow, and the amount required at the top for the nutritious diet. And then in blue, you can see the contribution to the nutritious diet cost from a social cash transfer, a disability transfer, and the COVID emergency grant. So you can see that in this way, you can sort of quantify the contribution that is made to reducing that affordability gap. Yeah, next slide. Yeah, and here, this is to show that with the same amount of money, you can make a different contribution to meeting your nutritional needs because you can spend it differently. So this is an example from Ethiopia with a fresh food voucher. If that fresh food voucher was used to buy potatoes and onions, the reduction in the cost of the diet that the household now still needs to spend is relatively small. But if you go all the way to the right, and if they were buying milk and kale to the same monetary amount, so they're still spending the same voucher, the same value, they could get better nutritional content. So it's also really important to explain what choices are better and can better meet the needs. So that brings me to the conclusions of this first section. It's important for nutrition-sensitive design to estimate the cost of a nutrient-adequate diet and that affordability gap, and to do so subnationally and across seasons. And many governments are collecting food prices for CPI calculations. So this requires work with bureaus of statistics to be able to do this monitoring. Really important to look at different groups across the life cycle, because the vulnerabilities are different. We've also seen that the affordability gap is relatively large compared to the social protection transfers in the examples I just showed. So how can you improve the transfer package to make as much as you can a reduction of that affordability gap? So it's about optimizing the choices. It's about linking with the food system to reduce cost of nutritious foods. It's also about increasing the transfer size and adding vouchers for specific foods, and we'll hear about examples in that later in this webinar. And to do a top-up transfer for the most nutritionally vulnerable groups. We can target the entire household, but if we don't have enough of the resources, we should zoom in on those that need the assistance the most. And then adding nutrition-specific interventions and referral. And also co-location of programs. It's not all on social protection alone to improve nutrition, health, and much more. So with that, I want to hand it over to Dr. Stephen Devereaux to talk about how to apply these metrics for social assistance. Over to you.
Thank you very much, Saskia. And before I get going on my section, I would just like to say what a great pleasure it has been for me to work with WFP on this important study. I think that the full nutrient gap analysis is perhaps, it needs to be more publicized. You know, for me, it's actually revolutionized the way I think about poverty measurement and about social protection programming. Because let me take two examples from Saskia's presentation. The first one was that, as she pointed out, we often measure social transfer programs against the food poverty line, for instance. But the food poverty line is just measuring calories, usually, calories for energy. And as Saskia pointed out, that's completely inadequate. You know, very often when we do evaluations of social transfer programs, we find that there's improvement in food security indicators because people get more cash, they buy more food, but it doesn't really affect nutritional outcomes because that requires an additional investment and more diversified food than you can buy with just a small cash transfer calibrated to the food poverty line. And the second example is that chart that Saskia showed of the needs of adolescent girls versus adult men. You know, for all of my life, I've thought adult men have higher energy requirements, not just because they're bigger, but also they do a lot of manual labor. But as we saw, the nutritional requirements for adolescent girls and pregnant and lactating mothers is actually much higher than the nutritional requirements for men. So you probably need to spend more on adolescent girls than you do on adult men. And that's a completely different way to thinking about nutrition than we have done for most of my career anyway. Okay, so with that in mind, I just want to highlight some findings which are more specifically about what the implications are of this analysis for social protection. As we know, social protection interventions can play a very catalytic role for improving nutrition and human capital development. We know that nutrition is essential for human capital development. So how can this methodology help? Firstly, it helps to identify who are the populations that are most in need so that we can target social protection programs towards those, especially the individuals and households that have the largest affordability gap. Secondly, it reduces socioeconomic barriers to nutritious diets. In other words, it makes us aware of what the gaps are and how those gaps need to be filled for different people or different stages of life through the entire life cycle. Thirdly, it prevents the use of negative coping strategies when people are running down their assets, because you can find a way of protecting the quantity and the quality of food intake through well-designed social protection, which is going to reduce the use of negative coping strategies. Fourthly, it supports the uptake of essential nutrition and social services. As this obviously means health and education, but also nutrition-specific interventions to address the underlying causes of malnutrition and not just give people cash transfers and assume that that's enough to meet all their nutritional needs. They will need additional services that you can link to. And finally, it lowers the cost of malnutrition so that a well-designed program can help children reach their full potential and families to live more productive and healthier lives. So there are many, many ways that social protection impacts not just on food security, but also on nutritional outcomes. Moving to the next slide, there are several ways of assessing the effectiveness of a social protection system. And if we are looking at it in terms of how nutrition sensitive the social protection system is, there are 5 criteria that we will briefly consider. The first, of course, is coverage. How many people are being reached by a social protection program and who is being reached? So given that we can't always reach everybody, the action that is indicated from the FNG analysis is you want to prioritize the population groups that are most unable to meet their food security and nutritional needs. In other words, those that are most in food deficit, in nutritional deficit, in biological poverty. Examples of those kind of people would be rural seasonal workers, urban informal workers who are left out of social protection systems, migrants, refugees, displaced people who are dislocated from their food supply, and of course we already heard about adolescent girls and pregnant and lactating women. The second dimension is adequacy. Adequacy means making sure that we're giving enough. And as I pointed out, a food poverty line is not enough to meet nutritional needs. You've got to go beyond that. So you have to design transfers to cover the cost of nutritious diets, not just calorie needs. And this doesn't mean just giving people more cash. It also means providing specialized nutritious food, as they have done in Pakistan, or fresh food vouchers, as they have done in Ethiopia, to make sure that people are getting micronutrients as well as calories and protein. The third dimension is comprehensiveness. Are we meeting people's needs comprehensively through the life cycle? So both through the life cycle and by linking to other services. So for example, in a couple of country case studies, Kenya and Pakistan, we have seen linkages to antenatal nutrition, immunization services, infant and young child feeding, and in Chile, also focusing on food producers' livelihoods, trying to increase the incomes of small farmers and laborers as a way of making sure that those groups are comprehensively met. Fourthly, we talk about the quality of a social protection system. And this doesn't mean the quality of food or cash that's provided. It means that the program must be designed in a way that's inclusive. It must empower people. It must meet local needs and preferences, for example. And of course, in these days when we're concerned about food safety, it must be good quality food and good quality nutrition that's provided. Some examples of how you can improve the quality of services: using mobile money to make it easier and more flexible for people to access cash or vouchers or food through vouchers, introducing complaint or grievance mechanisms and making systems more accountable so that people who are left out unintentionally can get onto the program, and being very consultative and participatory about designing these systems to meet people's real needs. And the fifth dimension is responsiveness, increasing these, especially since COVID-19. We have been concerned that systems must be flexible and adaptive to shocks, as well as predictable shocks, which are seasonal shocks, seasonal fluctuations in food availability and prices. And we can do this by connecting social protection to early warning systems to make sure that responses to shocks are timely. And we can also connect people to social insurance and livelihood schemes to try to reduce the effects of seasonality and protect them against future shocks. Next slide. So just a reminder that the report that we're talking about today is called Mind the Gap, and it's based on the full nutrient gap methodology, FNG methodology. And it talks about ways that we can improve those 5 dimensions that I've just talked about: coverage, adequacy, comprehensiveness, quality, and responsiveness of national social protection systems to make sure that they meet people's nutritional needs and not just a poverty line or a food poverty line. And this publication, which you can find on the WFP website, it has case studies from 12 countries across Africa, Asia, and Latin America. And I'm going to briefly discuss a few of the findings from those case studies now. So looking first at Lesotho, the FNG analysis there, often these studies start with a modeling. They collect data and then they model the effects of different types of interventions or different types of deficits. And what they found in Lesotho is that there was a deficit in terms of micronutrients. So if you provided micronutrient powders in the form of a supplement to children aged 6 to 23 months, you'd improve the nutritional development of those children. So that was one gap that was identified and filled. And similarly, it was found that children faced nutritional deficits during the lean season, the hungry season every year. And so school meals were improved in terms of their nutritional quality during the lean season, specifically to protect children against that. In Tunisia, where bread subsidies were being removed, the F&G analysis found that this would increase the cost of a nutritious diet by 9%. So removing the subsidy is actually an income shock to poor households, and it increased the cost by 9%. So recommendations were made to try and deal with that by phasing out subsidies and trying to take that subsidy dividend and allocate it towards nutrition-sensitive interventions targeted to those who are worst affected by that policy reform. In Pakistan, the F&G analysis also revealed that there were large affordability gaps. Even after receiving support from the Benazir Income Support Program, there was still a 50% gap in affordability of a nutritious diet. And this led to the launch of a spin-off program, which provides conditional cash transfers for beneficiaries or participants to visit health centers to get immunized and have antenatal care and young child feeding, and nutritious food provided to pregnant and breastfeeding women and young children. And we'll hear more about that from Dr. Azim in a minute. The last couple of examples I want to talk about are from Ecuador and Philippines and Nepal. In Ecuador, a particular issue that was found is the impact of high teenage pregnancy rates on nutrition status of adolescent girls and their children, often born with low birth weight. So this led to the intervention of nutrition-specific interventions for adolescents, and specifically providing iron supplements to supplement cash transfers, which cut the cost of a nutritious diet for pregnant women by more than half. So the iron supplements were very important for women to avoid anemia, and simply increasing cash transfers wouldn't address that as effectively as providing supplementation. In the Philippines, the flagship social protection program there only covers 10 to 22% of the cost of a nutritious diet. And then when that's added to household income, there remains a 25% affordability gap for the poorest households. So WFP worked with the government to help finalize a plan that reduced the gap to just 6%. So they intervened specifically on the affordability gap for the poor. In Nepal, it was found that if you improve targeting, the big issue in Nepal is that people have difficult nutritional situations the further they are away from cities and the capital especially. So living in remote areas, living in mountainous areas, indigenous communities, these categories of people had much higher affordability gaps and deficient diets than people living in Kathmandu, for example. So one intervention that was done is that responses, cash transfers, and other interventions were calibrated by geographic area. So if you're further away, you should get a bit more to help you deal with the costs of accessing a nutritious diet being higher in those areas. And similarly, combining social protection with behavior change communication, explaining to people the importance of nutritious diet, of diversified diets, of breastfeeding, and so on, that help promote healthier food choices and healthier and more nutritious outcomes, especially for children. So to conclude, we found that the use of the Fill the Nutrient Gap analysis has been incredibly helpful in many ways. Firstly, to help assess not just the coverage and adequacy of the social protection system, which are the two indicators most commonly reported on, how many people are reached and how adequate are the transfers. We also have to look at comprehensiveness, quality, and responsiveness. Are we linking people to nutritional services? Is the quality of the service being provided high? And is it responsive to shocks and needs through the life cycle? Secondly, it's important, and we've heard this again and again from Saskia and from the case studies I've talked about, that you can't just try to fill energy deficiency gaps. That's not enough. You need to have a nutritious diet, and that's going to be a different set of foods and a higher cost probably than just providing calories in the form of cash transfers or food assistance. It's also important to design and prioritize food security and nutrition-sensitive social assistance programs. Again, moving beyond cash transfers or even food transfers to nutrition-sensitive programs requires a different way of thinking about this. And one of the ways of thinking differently is to link that to complementary interventions, not just social services like health and education, but also livelihood support. A final point that's really important to emphasize is that it's clear from the data that Saskia presented that the affordability gap to a nutritious diet is much higher than the affordability gap to an energy sufficient diet. So the poorest can't even meet their energy needs, but it's not enough just to give them enough cash or food to meet their energy needs. It's not enough just to get them to the food poverty line. The nutrition poverty line, or the biological poverty line, is higher. And this implies that social protection budgets will need to increase significantly because nutritious diets are expensive. But it's crucial that we do this. This is an investment. It's an investment in human capital development. It's an investment in the future. It's going to accelerate human development. It's going to contribute to economic growth. It's going to reduce malnutrition. To put it the other way around, there's hardly any point in giving people tiny amounts of money that just allow them to buy a bit more bread if they remain malnourished and if they remain with low human capital development. So a nutritious diet is the gold standard, and how we get people there is through a number of interventions, of which social protection is one. But it isn't just giving people cash or food transfers. You can almost think about it as a two-pronged approach. One is social protection in the form of transfers, but the other is getting people access to nutritional diets, which means fortification, supplements, vouchers for fresh food and vegetables, a range of different interventions that can be introduced, which are focusing on nutrition, not so much on cash poverty. So lastly, the best way to probably go about this, recognizing that there will be additional investments required, is to have an aspirational, progressive approach. So let's start with cost-efficient ways to improve nutritional value. For example, fortifying rice, relatively cheap and reaches a lot of people, and prioritizing the most nutritionally vulnerable, e.g. children in the first 1,000 days and adolescent girls. And let's build from there to reach nutritional diets for everybody, which is the ultimate goal. Thank you.
Thank you very much to Stephen and to Saskia for this great presentation, really insightful, and also to just give justice to this Mind the Gap publication, which has just been launched in October 2024 and is available actually on the link. And please take a further look at it, at the 12 case studies. There's a rich set of examples. So thank you so much. In the meanwhile, please start posting questions on the chat, on the Q&A chat box if you have specific questions on these presentations. And now we are going to, in the meanwhile, thank you so much, Stephen and Saskia. Let's move to the country dialogue. And I give the mic to Juan Gonzalo to actually moderate this session and introduce our panelists again and start the dialogue. Thank you very much. Over to you, Juan.
Yes, thank you, Julia, and thank you to Stephen and Saskia, and to everyone who's part of this webinar today and joining us from all over the world. Today, I will moderate, as Julia said, the second segment of today's webinar, where we will listen from the government perspectives. We can move to the next slide, and I have the immense pleasure to be today with Dr. Asim Ilyas, who is the Director General of one of the most groundbreaking programs in the world, the Benecer Income Support Program, where he manages not only the conditional cash transfer, but also the National Socioeconomic Registry. So we're very thankful for your time, Dr. Asim, to be with us. But at the same time, we have from WFP, we have Rebecca Johannes, who's currently leading the social protection capacity strengthening work at WFP Ethiopia. And at the same time, from the other side of the Atlantic, we have Carla El Rocio Mejia Jurado, who is our regional advisor for nutrition in Latin America and the Caribbean. So with that, we will give you a perspective of both Asia, Southern Africa, is from Sub-Saharan Africa, and Latin America. So we can move to the next question, which would be now to Dr. Asim, which I'm very happy, as I said, to have here with us. And I wanted to hear from you from Pakistan. How has the F&G, the Field and Nutrient Gap analysis, shaped your government's approach to making social protection systems more nutrition sensitive. Doctor, over to you.
Thank you very much, and thank you very much to WFP as well for having me on the board and sharing the outcomes that BISP have so far achieved. So thank you once again for the findings that FNG report had made in 2017. So I will share two of the main issues that were actually identified in that FNG report in 2017. So the first one was the affordability issue that was considered as the primary obstacle to attain a nutritious diet. And the second one was the inadequate dietary and feeding practices among the infants and the children's that was observed in this report. So for these two main obstacles, BISP tried to address these issues by two ways. One was the cash assistance, provision of cash assistance, and on this parallel side, we also tried to assess them in shape of in kind grants. So I hope I'm audible because I saw a message that my internet is not connected. Am I audible?
Yeah, we
Okay,
can hear you
that's
well.
I just
Perfect.
saw I just
Thank you, Dr. Aziz.
I just saw a message on it. So okay, so BISP basically have addressed these issues both in terms of cash assistance as well as in-kind assistance to our poorest of the poor beneficiaries. For the cash assistance, at times, this type of cash assistance can only address the affordability, but not exactly the stunting issue, which might not be tackled properly. So, for the reason, there are so many reasons for this because the major one, I would say that because they do not have the awareness of nutritious food choices. So that's the main reason that their priorities are set on the other way, and the cash assistance that is given to them are spent on some other things which are not food items, or even if these are food items that are not that nutritious food items. So for the reason, BISP has done two things. One is the cash stipend, which actually support them in the income support, and we also provide them the nutritious food as well, considering that they do not have that awareness. But we do not stop over here. We also do the SBCC component, that is the social behavior change component. So as you know that people purchase this non-nutritious food, so we had to educate them, and we ultimately involved our SBCC coordinators in this. So recognizes these challenges, it is imperative to explore different interventions to develop a comprehensive program addressing both the affordability and stunting. So just I must appreciate the FNG gap report that led us to think on this aspect, and we started the best Nashonuma program. So and second thing that also validated is the Aga Khan Research University report that was done on this National MAP program as well, that supported the combination of cash assistance with the lipid-based nutrient supplements as well. So as we already narrated it in earlier presentation, that it was given to the children up to the age between 6 to 23 months, and to the pregnant and lactating women as well. So this combination of interventions was proven effective in reducing the stunting prevalence among the age that I already mentioned. So the Nashonuma, I would again say that the Nashonuma intervention was actually developed based on the analysis of this FNG report of 2017, and on the research study that was done by the AKU. Secondly, I would say that the CCT component, because the BISP is previously famous for its unconditional cash transfer program. that is facilitated to about now 10 million beneficiaries throughout the country. But now having this understanding of Nashonoma and the FNG report, we have realized to just start the CCT component as well. But not only the conditional cash transfer, we have clubbed it with the behavior change and human development, which actually offers a long-term approach to poverty elevation. So the BESP has strategically linked health and nutrition with CCT also, the conditional cash transfer, to address the stunting. So because in principle, BISP was given the mandate that actually did not encompass the to address the overall issue of stunting. Rather, it was a income support program. But now we are prioritizing the stunting prevention as well through our CCT programs and through our social and behavior change communication consultants. So, and particularly this is as earlier said that it's for the first 1,000 days. So this was, I hope I have answered your question, that because of the FNG, we have been able to make all these steps.
Wow, impressive. Very much indeed. So just to recap, you have ensured not just programmatically that you are linking cash with a specialized nutritious foods and providing a social behavioral change and communication, but change also your priorities by shifting from a narrow view into income poverty to look more broadly into vulnerability in your programming, which is incredible, by focusing on stunting.
Very right, because we realized that the stipend that was given in term of unconditional cash transfer was exactly not spent on the stunting issue, and this was highlighted in the FNG as well as in the AKU report. So we ultimately decided that we have to address this particular issue of that vulnerable society of for which we are exactly working for. But in our unconditional cash transfer, it was not exactly addressing. So because of the priorities, or you can say that the wish list of the children, so this specific in-kind support is now made just to address particular issues of stunting.
Great. Dr. Asim, thank you so much for that. I think that there's a very clear example here on how Pakistan is using evidence to guide its decision-making, its programming and policy in social protection. We hope many of the countries that are here watching and hear your testimony can follow suit, as the Mind the Gap shows. So let me now, Dr. Asim, move to Rebecca from WFP Ethiopia. And I would like to hear from you, Rebecca, about exactly how has the FNG shaped the Ethiopian government's approach to making social protection more nutrition sensitive. And then I will ask you a second question around coordination. Yeah, but let's start with that one. Thank you, Rebecca.
Thank you. Thank you for having me in this panel. It's a very important deliberation on the nutrition gap analysis and its contribution to partner countries' approach to making social protection system more nutrition sensitive. For Ethiopia's case, I would want to talk about the largest social protection program in the country, which is the Productive Safety Net program, what we call PSNP, which was launched in 2005 by the Ethiopian government with the aim to address chronic food insecurity and building the resilience among vulnerable rural populations. The PSNP it's a very large-scale social protection program that combines public works, employment, and unconditional food and cash transfers. It targets households that are chronically food insecure and often affected by shocks like droughts and flood. The program has been implemented across several regions in the country and currently reaches about 8 million beneficiaries. As I mentioned, the key features of the PSNP includes the public works employment, where it provides temporary work opportunities for beneficiaries to earn income and build community assets. The other component is the unconditional cash transfer directed to vulnerable households, particularly during times of crisis. And it also has a third component, which is the livelihood, that aims to protect vulnerable households from shocks and promote long-term resilience. So the PSNP has impact on reducing the food security and as well as malnutrition and in some instances of for the vulnerable communities in Ethiopia. Currently, the program is on its 5th phase, and a 6th phase is now being developed. And as WFP, we engage in the design process. And one of the key issues as WFP we are advocating for and supporting is a nutrition-sensitive program. As informed by the F&G analysis, key areas that are being considered by WFP and partners is one, the need for dietary diversity. We advocate for integration of nutrition education and dietary guidelines into the social protection program, PSNP, the next phase. Also through social and behavioral change communication, promote the importance of nutrient-dense foods in preventing malnutrition and disease is also something that we are advocating. In areas where WFP's fresh food voucher program is being implemented, we have acknowledged an increased knowledge and attitude as well as practice of beneficiaries in consuming more nutritious food. In addition to advocating and supporting the dietary diversity, we also consider targeting very important. As already been mentioned, the nutritional requirements for different groups of people is different. So as identified, and presented by the F&G analysis, specific vulnerable groups such as pregnant, lactating women, infants, young children and adolescents, women require a targeted intervention. And this has informed the design of a conditional cash transfer to incentivize healthy behavior and improve the dietary intakes of these specific groups. For example, in addition, like pregnant and lactating women are also excluded from doing public works. And will, in that period, will benefit from a direct transfer benefits. If we look at the resources of the PSNP program, already the government has allocated 3% of the public works and the livelihood component of the budget for a nutrition sensitive interventions to address the comprehensiveness of the program, where it is not only make food transfer, but also improves the livelihood and resilience and of the beneficiaries. Frequency of transfer, adequacy of transfer is also something we are looking at. The WFP implements the FFV, the fresh food voucher, to make sure people get the needed nutritions and calories. And this is also something that we are also advocating for the National Social Protection Program to take up. Yes, definitely the F&G. I mean, these all steps have been informed by the analysis and are being supported by the WFP's advocacy and program support. Over to you.
Wow, that's really, really interesting, considering that the PSNP is one of those groundbreaking programs that are not only looking at food security, but also on how to respond and ensure consumption in times of crisis, such as drought, by integrating not just the provision of food, but also on promoting livelihoods, which is another key element here. But the FNG, as you said, bringing that analysis, for example, around pregnant and lactating women, requiring a different sort of programmatic solution, really, really, really interesting. Not just to mention that you have really kind of like touch similar to Pakistan, the different dimensions outlined by Dr. Devereaux. So now, you know, Rebecca, we always say that social protection cannot do it all, right? We need multi-sectoral coordination and collaboration in order to make, as Saskia showed us in that pie cake, right? That we need interventions around agriculture, around health, education, to really see a change, to make you know, the diets not just affordable, but also translating to nutrition outcomes at scale. Can you tell us how has the FNG analysis helped towards that collaboration and addressing any challenges there?
Yes. Well, the Ethiopian government and its partners, you know, have recognized the importance of a robust food system to address the affordability and also the accessibility issues around nutritious diet. The government is pursuing, you know, developmental policies that promote sustainable agriculture, support smallholder farmers, and improve the access of nutritious food. Notably, here I want to talk about the Ethiopian food systems roadmap, with a goal to make, which has a goal to make nutritious food accessible and affordable through its, you know, several key activities, which include one, ensuring food security through increasing agricultural production, reducing post-harvest losses, and improving food distribution. Improving nutrition is also another activity under the roadmap that promote diversified diet and improve food fortification. There's also the resilience building part of it, which enhancing the resilience of the food system to climate change and other shocks. There's promoting sustainable agriculture, adapting climate smart agriculture, you know, reducing the environmental impact, and also empowering the smallholder farmers, supporting them through access to finance, technology, market, and all that. So these initiatives cannot be implemented by one agency or a ministry. There is clearly a need for a multi-sectoral approach and coordination, and the government's approach for implementing the National Food Systems Program recognizes that food systems are interconnected and requires a holistic approach involving various sectors, including the agriculture sector for which is responsible for food production, including, you know, livestock farming, the health sector, focusing on the prevention and management of malnutrition and issues of food safety, as well as public health, promoting breastfeeding, antenatal, postnatal cares for mothers. There's also the involvement of the Trade and Industry Ministry that involves in the processing, packaging, and distribution of nutritious food. And of course, the social protection, which provides the safety net and support to vulnerable populations. Food needs. So, you know, I want to, it's a very complex and multi-sectoral approach, and it's not just being implemented by one government agency, but of course there are challenges that have been observed in implementing this multi-sectoral food systems program, including, lack of institutional capacity. There is clearly limited institutional capacity within government agencies, and other partners to effectively implement and also monitor this program. And also there's the challenge around resources. There seems to be inefficient allocation of resources, both financial and human resources across sectors for this very important initiative that seeks to, try to address the challenges of accessibility and affordability of nutrition diets. Let me
Great.
stop. Yeah.
No, that's lovely. You know, we're having a really nice conversation in line with what you answered in the chat, as we ask others that are joining us to really go to the chat and pose any questions. What you're saying is that social protection cannot really do it all, and the analytics help us to look beyond the social protection system, what needs to happen in the food system and in the financial allocations that we have for different programs. Barbara Rowe-Reger in the chat has actually asked about exactly how do we not only increase the purchasing power of people, but how do we actually reduce the cost of the diets? And your example here, Rebecca, and the very thoughtful answer that Saskia is providing around, bringing also the case of Tunisia, which is very similar to the case of Iraq, with the subsidies of bread, are very important. Professor Stephen Devereaux also reminds us that, we cannot just make social protection come and increase the affordability, but the reduction of the diets needs to come in parallel. So we really see those reductions in food insecurity and malnutrition at scale now. So thank you for that. Asking others to join. Stephen, there is a question by Alexandra Kranzinska around sustainability. How does this affordability can help to make programs more politically and economically sustainable, looking at those things? So I would ask you to maybe think, as we speak to Carla and Rocio now, to bring you on board to answer that question after we hear from Carla. And now we move to the other side of the Atlantic, to Panama, where Carla leads the nutrition agenda. And I wanted to ask about, some of the work that has been done in the region using these analytics, the F&G analytics. You work very closely with Julia on making those analytics, available to countries. And we would love to hear how that resulted in systems being more nutrition sensitive, those social protection systems. So over to you, and I'll have another question for you. Thank you.
Yeah, no, thank you for the invite. And just to give you a framework and give all the framework that in this region, we have to grapple with the double or triple burden of malnutrition, which is that households and societies have to live at the same time with stagnant stunting rates, while at the same time an incremental prevalence of childhood, especially childhood obesity in countries. I'm currently in Peru now. The obesity of the rate of obesity is a few times over the global average, for example. And so when we think about how these systems can foster healthy diets, we need to think a little bit about all these linkages, not only to foster the reduction of stunting and anemia rates, which are also high, but also how to really introduce the thinking around how to manage and prevent further increments of obesity rates. So having said that, for example, in the region, we did an analysis of what has been done in social protection. As you know, social protection in this region has been one of the main interventions to reduce poverty, under the thinking that not only by reducing poverty, we're reducing food insecurity and malnutrition. And there quite a few interventions focus on the linkages between health and social protection, who have been able to reduce stunting quite significantly, like in Peru, in Brazil, and other countries in South America mainly. What we found out, though, is that not knowingly, we did foster the reduction of food insecurity and undernutrition, but because of the lack of linkages with adequate food systems, and because we didn't really focus on the strengthening the piece on food systems and infrastructure to foster the strengthening of food systems, we unknowingly foster really cheap foods to become available to the population. And by doing so, we probably foster obesity to increase and to really foster the availability of an obesogenic food environment to most of the population. We know now that the cost of diet in the region is the highest around the globe, and therefore people who are beneficiaries of social protection tend to also consume high levels of ultra-processed foods. So that's something to think about, because in a way, what we have done so far with the FNG has focused on linking how to strengthen the food systems at scale, as well as health systems, to focus on this dual burden of malnutrition. And I think Saskia mentioned in the response, for example, in the Dominican Republic, the recommendations of the FNG really grounded the work on fortification of rice. Rice is the main commodity that is consumed in the Dominican Republic as source of carbohydrates. And because micronutrients through fruits and vegetables are mostly unavailable to people who are beneficiaries of social protection and school feeding, we focus on not only introduce fortified rice through school feeding in a mandatory way, but also to increase the levels of micronutrients adequately in rice, while at the same time trying to foster a strengthening of the food systems via interventions in the agriculture sector. Another issue that was quite clear to us is that one of the population groups that were quite, let's say, quite costly, in terms of requirements, nutritional requirements, were adolescent girls, and I believe someone else focused on that as well in the previous discussions. And a lot of the FNG results did mention or do conclude that that the requirements in nutrition for adolescent girls result in a high cost of diet for this particular age cohort. When we work with the government of Colombia, for example, that knowledge allowed the government of Colombia to basically refocus the targeting of some of their programs into households who have adolescent girls as part of the household, which, if you think about it, it means a lot of work in terms of retargeting. And I believe the government of Colombia was able to benefit 1.7 million households, additional to the previous households, just because they rethought how can we benefit these adolescent girls to increase their access to nutritious diets. So not only they retargeted and increased the transfer value for these households, but also link it with SBC programs to allow people to make better decisions. So those are the things that the FNG practically can help countries in terms of policy making, but also in terms of program design. Now, in terms of opportunities, in my opinion, the FNG is very helpful when it's coupled as well with advocacy plans, no? Because I think Alexandra was mentioning something around how to make this sustainable. And really in this region, what has worked, as far as I know, is when countries decide to advocate the political will of those who hold the purse, let that be the Ministry of Planning or the Ministry of Finance, or the the general, their congressional assemblies in the way that they result in in a way, a political will that focuses not only in nutrition per se, but in better nutrition as a basis for human development and human capital development. From the point of view that without proper nutrition and by people not reaching their potential, they're really missing out on GDP growth. So when we couple these discussions on the lack of GDP growth, on the lack of opportunity, on all the missed opportunity by people not reaching their productivity potential, is when we can make a little bit of an inroad in the thinking of it might be more cost effective to invest now in people's nutrition as opposed to investing in incurring on all the cost that implies people who might not be given the amount of resources to recover from stunting or preventing their stunting, or to manage all the chronic diseases that result from obesity and at the rates that we have in the region. No? So those are the things that, in a way, when they are coupled to the FNG, because we also have quite a few analyses on the cost of the double burden of malnutrition, we have found that then the political will really can be really, in a way, focused towards managing this issue of malnutrition in all its forms.
Wow, really good. And I would really ask you, Carla, because the work that you've been doing with partners like ECLAC, like the Economic Commission for Latin America and the Caribbean, in bringing to the fore really the multiple burden of malnutrition is so important, but would be great to share it, because oftentimes we don't talk about that in social protection. Oftentimes the discussion has been around undernutrition. So it's great to see that. It's great to see how the FNG is helping on that. It's great to see, for example, in the case of Colombia, the coverage and the prioritization, several populations reaching millions of people that otherwise wouldn't be reached by having that look. And I would also say that, noting on the work you guys have been doing in the region, like such as the social protection pathways to nutrition, where you also have stressed that social protection cannot do it all, and you need several systems in place. How have you leveraged the findings of this specific analysis, the FNG, and other studies you've done that tell the need of collaboration between sectors, this multi-sectoral collaboration?
Yeah, that's a very good question. So in my opinion, the FNG is one of the most powerful tools that has enabled us to refocus the need of multisectorality, because nutrition it really is multicausal. You cannot only fix nutrition by fixing food. You need to fix nutrition. It's like, as I would compare it, as having a keyboard. You cannot fix it by just pressing one key. You need to press multiple keys at the same time, and you cannot do it just by yourself. You need other people or other sectors to do it. So, for example, now we are currently focusing on Peru and the work that we are doing on the FNG at the moment. And Peru has done amazing work in trying to fortify their main commodities, namely wheat and mostly rice. However, without a proper linkage to health, it's not that it wouldn't matter. It will just not be optimized, because if you don't have access to health to allow people to be properly cared for in terms of removal of all the parasites that exist in half of the population in Peru, unfortunately suffers of some sort of parasitosis, you will not be able to absorb the micronutrients that you are provided via fortification or supplementation. And we are talking about a country, for example, that has a total of 40+% of people suffer from anemia. So if you don't link the two systems, health with food and wash, you will not be able to resolve only anemia. And so we utilize the FNG to ground this discussion with all the sectors in the table at the table, and we were able to discuss what would be needed in terms of investment from the sectors to enable the mitigation of anemia, not only from fortification or supplementation, which the FNG helped the government of Peru to rethink the optimization of supplementation and fortification by making it mandatory, but also how to rethink the policy, the health policy around deparasitation and the WASH policy to allow the rural communities in Peru to be able to have a chance of having adequate water resources. So in a way, the FNG really grounds the discussion. On the other hand, the other work that we've done in terms of evidence generation, for example, the pathways to nutrition, really allowed us to think, how do we have to have the discussion on the double burden of malnutrition? We cannot in this region afford really not to have this discussion anymore. And it has to be from the design onward. The evidence allowed us to understand that if we don't think about these issues from the design, governments unfortunately will incur in additional costs for the redesign of these programs. Or they might run the risk of a lack of an optimized program, and which will not be able to address all the quite complex issues that now these countries face. For example, in the case of Ecuador, Ecuador has one program that focuses solely on the 1,000 days. Ecuador has still significant stunting rates, and the program is mainly focused to prevent stunting by linking not only the cash transfer for the households that have children below the age of 2, but also linking it with the health system to allow the vaccination rates to be up to date, healthcare to be up to date, and for the pregnant mother, if she's pregnant, to be able to be linked to the second child, so that the whole life cycle is taken care of. On the other hand, if the mother presents already symptoms or signs of being overweight or obese, there are linkages to SDC to allow better decision making in terms of food decisions for purchasing, while at the same time having different types of policy around food labeling, around communication for consumers, etc., that in a way have to be done to all population because of just the sheer of prevalence of obesity. If that is not in a way coordinated, efforts in advancing the mitigation of this of malnutrition are not shown to be very successful.
Good. That's amazing. Thank you so much for that. And Carla, thank you for that. We've shared also the Pathways to Nutrition work in the chat. Please do share the multiple burden of malnutrition, as we think this is definitely a key topic across other regions, but that they don't lack that evidence that has been so groundbreaking from your side. And now we will move to the questions and answers from the audience. Yeah, so I would like to give the floor to Professor Devereaux to talk a little bit about this question posed by Alexandra Krasinska on how to make social protection programs by reducing the affordability gap able to make it more sustainable politically, economically, socially. Do we talk about that in the Mind the Gap publication maybe? And then, I don't know, let's go with that one. And thank you, Carla, for the element of sustainability there that you shared as well. So Professor Devereaux, a pleasure as always.
Thank you, and thank you for that question. It's a very crucial question, and we do address it in the report. I should just mention that although we've talked about 5 dimensions of a nutrition-sensitive social protection system here, coverage, adequacy, responsiveness, quality, and comprehensiveness, there is a sixth dimension which has recently been added, which is sustainability. It is crucial that any interventions that are introduced to try and improve nutrition status of, especially of young children and adolescent girls, are sustained. It's not something you can do once only and then it's done forever. So sustainability can be seen as a political commitment, or it can be seen as a financial commitment. In my view, the one follows from the other. If you can get political commitment, financial resources will follow. So it's very crucial that we use the evidence from analyses like the fill the nutrient gap analysis, cost of a diet analysis, to convince policymakers and politicians and people with power that this is something that has to be invested in. And once they are convinced, they will do it. And we had a really great example today. I think the Colombia, the Latin American story is one, but clearly from Pakistan, we heard from Dr. Asim that the F&G report that was done in 2017 directly led to the creation of a new program through political will being directed at this issue, which has focused on improving nutritional status of children and other vulnerable groups in Pakistan. So a really effective way of translating evidence into action. Another example that's reported in the Fill the Gap report, Mind the Gap report, is from Timor-Leste, where a convincing argument was made that investing in nutritional status of school children would improve human capital outcome and lead to better development and growth for the economy overall in future years and decades. And so that led to a doubling of government investment in the national school feeding program. So political will is crucial, and that can be enhanced with convincing evidence. And after you've built political will, resources will be found to translate that commitment into real actions. And so sustainability is the ultimate goal, and it needs evidence followed by political commitment, followed by financial resources. Thanks.
Great. Awesome for that. I have one question for Saskia, and then we will ask Dr. Asim as well. A little bit of a figure on the National Numa that I will leave Saskia to voice. But Saskia, we have still from Barbara. Barbara, we're so grateful for your engagement here, that you're questioning whether, since the cost of the diets, from what we understand in your question, it's higher for women, maybe we are creating a burden for gaining access to healthy diets by mainly women, particularly in weak administrative contexts. Saskia, what do you think about that from the experience of the FNG? And then do please share your question for Dr. Asim, as we are all about to close with the final remarks by the Global Head of Social Protection, Julia Baldi. Over.
Yeah, thank you, Juan Gonzalo, and thank you, Barbara. Yeah, so as we've seen from the findings, and as Carla also clearly spoke to, the cost of a nutritious diet for women are higher. And especially during adolescence, it's that nutrient density of the diet that is higher. So yeah, in that sense, it's good to recognize and then identify what that means for SBC, but also what it means for linkages to food system interventions as well as health system interventions. I hope that answers your question. And then I would like to pose a question to Dr. Asim. How many people have now been reached by the National Numa program? What is the scale of it? And do we understand correctly that it's funded entirely by the government of Pakistan?
Well, thank you, Saskia. At the moment, we have touched the figure of it's about 2.5 million beneficiaries. By mean of beneficiary, I mean that it's 2.5 million pregnant and lactating women that have been enrolled in our National Numa program, and they have been assisted either through our cash stipend or through in-kind support. And as I've already said, that what the in-kind support is. But what I want just to take your few seconds, that because of the report of this FNG, we also have taken 4 steps. One is that we have enhanced our cash transfer budget. And by January 2025, we are aiming to increase it about 3,000 a month to every household. And the second is that we have already started this nutrition specific intervention in which we provide them antenatal care. We provide them through our Department of Health, Provincial Department of Health. We provide them immunization, and we provide them food supplements that includes iron, folic acids, and the fortified flour as well. And the third thing is that we have done this SBCC component actively through our WFP and UNICEF partners. And the fourth step that BISP has taken after this FNG report is that we are maximizing our outreach to the far-flung areas that are rural areas through our dynamic registry centers in the 158 districts. And also the far-flung areas where the beneficiaries cannot reach out to us. So we have initiated the mobile registration system over there through the mobile registration vans. And the last but not the least, that for the rural areas specifically for Balochistan, for the CCT component, we have give them the leverage of PMT score. Like in routine, the PMT is 32 at the moment for this year, but for CCT component in the parts like Balochistan, it's 60 PMT. So these are all the four major initiatives that have been taken for these 2.5 million beneficiaries.
Wow, that's 2.5 million beneficiaries. I don't think that there would be a better way to close this question and answer and give the word to the person that has really pulled us all together, Julia. Thank you so much for your leadership and making sure that this work that has been done with Saskia, with an entire group of people for over years, gets to see the light. To Stephen Devereaux for being here with us as well in this questions and answers and answering all those questions. And Julia, over to you to help us close in the best note possible today, this amazing dialogue with colleagues, friends, and partners. Over.
Thank you very much, Juanjo, and thank you very much to all the panelists and really for the powerful messages that have come out of the experiences from the countries and from the regions and from the highlights from the Mind the Gap publication, which really has been a collaborative effort between social protection and nutrition to really move this agenda forward. So I think it's great to see this day and to see it all connected. I take a few kind of key messages that I've been hearing from all of you as a common thread. One is that nutrition-sensitive social protection is an investment in human capital development. And it's an investment that needs to be progressively implemented and it can be progressive, but it needs to be a progressive ambition, but intentional in program design, intentional in financing, intentional in investment at the level of also specific programs. This one is then there is a set of what to do in terms of what does the evidence tell us and what have been the implication. I have a few one is to combine household and individual household level interventions and transfers to individual specific vulnerable groups from a nutritional standpoint. And this combination is critical to have a greater impact. We have seen children under 2 in Pakistan. We've seen adolescent girls in the example of Colombia. Connect, not only transfer combined with interventions across different systems. We've heard from everyone that the connection between social protection system, food systems, and in particular food environment, and also health systems is critical to actually get the combination of integrated package across different sectors, without which is not possible to have a sustainable impact. And then measure and evaluate. I've heard from, if we don't show the impact and also the pathways through which we can actually have this this impact or show the results in affordability or reduction in the cost of diet, it's invisible what is done. And also we don't understand if we need to course correct. So that part super important, and also very powerful example from Pakistan as well on that. Then combination of life cycle approach and also having multiple entry point, programmatic entry points for better results, with also a focus on responsiveness to crises also across the year, and also looking at seasonality elements, looking at slow onset crisis, not only sudden onset crisis, and this is a very important element. And then looking at different dimensions of social protection systems, I mean, and the 5 dimension of like from going beyond coverage and adequacy to also cover other dimension, including the final element of sustainability. So I would actually like to kind of wrap it up. Like, I don't think I made justice to all the richness of the conversation, but these are my key takeaways. And thank you so much to all for really a great discussion today. Bye.
Thank you very much.
Thank you very much.
Thank you.
Take care,
Bye-bye.
everybody.
Bye.
Bye.